Have you ever found yourself racing from one thought to another, jumping between ideas, feeling like time slipped away before you even noticed, and then wondering, is it just me, or is something deeper going on? What if I told you that this restlessness, this intense inner motor, this blend of distraction and hyperfocus, isn't simply laziness or lack of willpower? It might be that your brain is working differently in ways that many people don't see or understand. Today, we're going to explore what it can feel like from the inside to live with attention, deficit hyperactivity disorder, or ADHD, how it interacts with your life, and what you can do to navigate it with compassion and clarity. By the end of this video, you'll have greater insight into your experience or someone you care about, practical ideas to feel more grounded, and a sense of possibility. What is ADHD? The term stands for Attention Deficit Hyperactivity Disorder. And yes, the word disorder can feel heavy, so let's hold that gently. We're talking about a brain and behavior pattern where attention, impulse control, or activity level differ in ways that interfere with daily functioning and quality of life. According to the CDC, ADHD is one of the most common neurodevelopmental conditions, usually beginning in childhood but often continuing into adulthood. From the inside, living with ADHD might feel like this. You're at a task ready to begin, and before you know it, your mind has wandered off to a dozen other tabs. Or you're in a meeting and physically you're still sitting, but mentally you're bouncing. Your thoughts are sprinting ahead. You might feel like you're driven by an internal motor, wanting to go, move, start, switch, chase. Or paradoxically, you might feel stuck, unable to start, because you're overwhelmed by the many things you should do. It's important to bust a myth right away. ADHD is not about laziness, bad parenting, or lack of intelligence. Neuroscientific evidence shows that it's rooted in how certain brain networks develop and regulate attention, impulses, and activity. Another misconception, that it only affects children. In fact, many adults continue with symptoms, sometimes only realizing later in life. 1. Symptoms and early warning signs. Let's move into the kinds of signs people may notice. Emotionally, cognitively, physically, behaviorally. These are indicators, not a checklist to self-diagnose. Cognitive/inattentive signs. You struggle to maintain focus on tasks that aren't instantly engaging. You might make careless mistakes, lose things, keys, phone, lists, forget appointments, find yourself rereading the same paragraph, or get distracted by background noise or your own thoughts. The NIMH lists things like difficulty organizing tasks, managing time, and finishing assignments. Behavioral hyperactivity, impulsivity signs. You may feel restless inside, fidget, tap your feet, move around when you're expected to sit still. You might interrupt others, act before thinking, struggle with waiting your turn, or blur out an answer. These are classic signs from the NIMH fact sheet. Emotional regulation signs. It's common to feel that you experience emotions more intensely, bounce quickly from excitement to frustration, or have a low tolerance for boredom. That mental rapid fire of thoughts can lead to overwhelm. Time-related and executive function signs. You grasp that you should start that report, study, or even pay the bill, but time slips. You might misjudge how long something will take. Time blindness. You might procrastinate because the idea of starting floods you. Late deadlines, running late, or switching at last minute become patterns. Internal experience examples. For instance, you get lost in a hobby or idea so intensely you forget to eat or check your watch. Hyperfocus. And then you might later find you were unable to shift out of it when you should. That is also common but not widely recognized. Setting and persistence. Importantly, the symptoms show up in more than one setting. Work, school, home, and they've persisted long enough to affect functioning. Early warning signs might appear in childhood as difficulty staying on task in class, trouble completing homework, fidgeting, losing things, or being always on the go. But because every brain is unique, signs may differ in girls versus boys, or may be missed when hyperactivity is less overt and inattentiveness dominates. 2. Risk factors. What increases the likelihood that someone's experience and brain wiring will align with ADHD? It's not about blame, it's about understanding vulnerability and context. Genetic/heritable factors. Research shows ADHD tends to run in families. Twin studies estimate heritability at around 70 to 80%. Prenatal and early life environmental factors. Being born with very low birth weight or prematurely exposure to certain environmental toxins, prenatal maternal stress, smoking or alcohol exposure during pregnancy, all these show associations with increased risk. Brain development and neurobiology. Given the neurodevelopmental nature of ADHD under brain development over childhood and adolescence, factors like delayed executive function maturation matter. Psychosocial and lifestyle context. While not caused in isolation, things like irregular sleep, high stress, chaotic environments may exacerbate expression or severity of symptoms. The good news is these are modifiable areas. You might have inherited some wiring and life shaped how it shows up. But this does not mean you're doomed, far from it. Understanding the risk factors gives you more awareness and power. 3. The root causes. Let's dig a little deeper, without getting overly technical, into how the brain works in ADHD using metaphors to help. Imagine your brain is like an airport control tower coordinating flights. Your thoughts, attention, impulses, coming in and out, guiding takeoffs and landings, making sure no collisions happen. In ADHD, several things may be happening. The control tower, which we can think of as the prefrontal cortex and its networks, may be delayed or less consistent in its regulation of traffic. So attention may drift, distractors may get priority, impulses may take off without permission. Research shows differences in brain structure and connectivity in ADHD, particularly in networks of executive function. The air traffic signals, neurotransmitters like dopamine and norepinephrine, these chemical messengers help signal focus, reward, and regulation. In ADHD, the regulation of these signals is different. The reinforcement system may require more stimulation to feel meaningful. Metaphorically, your brain is saying, I'll pay attention when it feels urgent or exciting, and less when it feels routine. Scientific reviews support differences in dopaminergic and noradrenergic pathways. The runways and taxiways, brain networks for planning, organizing, shifting tasks, may be underbuilt or slower to develop. That's why you may find planning, preparing, starting, and finishing tasks harder. This is often called executive dysfunction. The incoming flights, stimuli, distractions may be more abundant, and your brain's filtering system may let more non-essential things enter. So you may find yourself hijacked by many distractions, which triggers hyperactivity, fidgeting, impulsivity. So ADHD isn't simply bad behavior or choosing to be distracted. It's about brain networks, chemistry, wiring, development, just like any brain-based variation. As you age and your brain builds stronger control systems, and with the right support, these flights can be better managed. 4. The connection to other mental health aspects. Understanding ADHD in isolation is helpful, but it rarely exists all alone. Often it intersects with other mental health aspects, and that intersection shapes the full experience. Comorbidity with anxiety and depression. Many people with ADHD also experience anxiety or low mood. The strain of managing constant distraction, feeling behind, or being misunderstood can lead to worry, shame, or sadness. The CDC reports that in children with ADHD, nearly 78% had at least one other co-occurring condition, including behavior problems or anxiety. Learning difficulties and executive functioning overlaps. Difficulties with attention, organization, memory may overlap with learning disorders or executive function deficits. That means school or work challenges may be multifactorial, not simply lack of trying. Emotional regulation and frustration tolerance. The same brain networks that regulate attention also help regulate emotion. So impulsivity and distraction may show up also as irritability, mood swings, or emotional reactivity. Sleep problems and lifestyle impacts. ADHD often links with sleep issues, difficulty falling asleep, irregular routines, restless nights. Poor sleep worsens attention, mood, impulse control, creating a vicious cycle. Self-esteem, identity, relationships. Over time, the experience of being different or struggling can shape how you see yourself, leading to self-criticism avoidance, or perfectionistic coping. Recognizing this link is key for holistic well-being. Productivity and burnout. Because people with ADHD may work in bursts, hyperfocus, or drift off, the pressure to compensate can lead to overwork, fatigue, burnout, or feeling chronically behind. Understanding ADHD as part of the picture helps avoid blaming yourself and instead creates realistic expectations. In short, ADHD doesn't just affect attention or behavior, it ripples into our emotional life, our relationships, our sense of self, and our rhythms of living. Recognizing it in context gives you compassion and clarity. 5. How it affects daily life. Let's talk about the day-to-day. Imagine waking up with the intention to get going on your tasks. But then the to-do list looms, your mind drifts, your phone pings, you switch to another tab, a new idea appears, then you remember you missed breakfast. Time has passed. You feel frustration rising. That is one real snapshot. In relationships, you might mean to respond to a message and forget, or intend to pay attention in a conversation, but your mind wanders. Loved ones may not see your internal effort, leading to misunderstanding. In work or school, deadlines may loom, yet starting is hard. You might procrastinate, then in a burst get it done, but feel exhausted afterwards. Or switch between projects and struggle with finishing anyone. That can produce guilt, shame, or avoidance. In self-image, you know you can focus when you're passionate, yet you struggle when you're not. That inconsistency may feel like you're not trying hard enough, but in fact you're trying. You're working with a brain wiring that is wired differently. In energy mood, because your internal engine is often running in overdrive or shifting gears abruptly, you might feel drained, irritable, restless, or understimulated. That catch-22, feeling you need stimulation yet overwhelmed by it, can be exhausting. So it is not just about being easily distracted, it's about how your internal engine, time perception, reward system, and task shifting operate together. Validating that experience matters. You're not failing, you're navigating a particular brain style. 6. Lifestyle changes that can help. Here are some practical, sustainable lifestyle habits that can support better balance and functioning. Not cures, but powerful allies. We'll talk about sleep, movement, nutrition, social connection, and mindfulness. Sleep hygiene. Strong, consistent sleep routines help stabilize your brain's control systems. Going to bed and waking at similar times, reducing screens before bed, creating a calm wind-down routine can support focus and impulse control. Physical activity. Regular movement boosts brain chemicals like dopamine and norepinephrine, improves executive function and mood. Studies show that aerobic exercise improves attention, inhibitory control, and flexibility in people with ADHD. Even moderate activity counts. You don't need extreme workouts right away. Nutrition and balanced diet. While there's no magic ADHD diet, research suggests that a nutrient-rich diet, fruits, vegetables, lean proteins, whole grains, healthy fats, supports brain function. On the other hand, diets high in processed foods and sugars may worsen symptoms. Try small shifts, simple breakfasts, regular meals, include protein and veggies, limit highs and lows in blood sugar. Structured environment/minimal distractions. Because brains with ADHD are more sensitive to distraction, creating predictable routines, clear physical spaces, desk clear, lists, timers for tasks, and chunking large tasks into smaller ones helps. Social connection and support. Having friends, mentors, or supportive communities who understand how you think is invaluable. It reduces isolation, boosts motivation, and reminds you you're not alone. Mindfulness and self-compassion. Regular practices like brief breathing exercises, noticing when your mind wanders and gently returning, help strengthen attention regulation over time. Pair that with self-compassion, recognizing when distraction or impulsivity shows up without harsh self-judgment makes a big difference. These changes don't need to happen all at once. The goal is gradual progress, one habit at a time. Celebrate small wins. 7. Actionable strategies and techniques. Now let's move into specific tools you can apply. For each, I'll explain what it is, why it works, and how to apply it. I'll include a brief illustration or case-style vignette. Technique 1. Time boxing with timers. What it is, you decide to work on a task for a fixed short interval, say 25 minutes. Set a timer, commit to full focus for that period, then take a short break. Why it works. Brains with ADHD often respond better to clearly bounded time blocks and external structure. The timer acts as an external prompt, reducing internal drift. How to apply. Pick one task, e.g., write introduction for report. Set a timer for 20 or 25 minutes. Work until the timer rings. After that, take a 5-minute break. Stretch, move, hydrate. Then do another block. Vignette. Sarah, a university student with ADHD, uses this method. She sets her phone on Do Not Disturb, writes for 25 minutes, then checks her messages in her break. She finds she starts more quickly, loses less time to wandering tabs. Technique 2. If-then planning, implementation intentions. What it is. You define in advance, if situation X happens, then I will do Y. Why it works. It reduces the decision load when you're already working with limited executive capacity. It makes your brain automatic rather than waiting for willpower. How to apply. For example, if my mind wanders while I'm reading, I will do 2 deep breaths and then reread the last paragraph. Or, if I remember I need to pay the bill, I will open the payment app within 10 minutes. A case style. Ahmed finds he keeps forgetting to send follow-up emails. He writes, if I finish a meeting and there's an action item, then I will draft the email within 30 minutes before doing anything else. That makes it happen. Technique 3. Journaling and brain download exercise. What it is. At a set time, e.g. end of day, you write out all the tasks, ideas, thoughts, worries swirling in your mind before you go to bed or switch to rest. Why it works. Unchecked, many thoughts stay in your mental queue, causing drift, distraction, insomnia, or anxiety. Writing them down externalizes and clears the mental space. How to apply. Spend 5 to 10 minutes. What do I need to remember tomorrow? What is wandering around my mind that I might forget? Then categorize into urgent tomorrow, soon this week, nice to do. Then close your journal and take a moment of 2-minute reflection. Case style. Maria, an adult with late diagnosed ADHD, found she woke up thinking about what she forgot the day before, impairing sleep. She now journals briefly before bed and notices she sleeps more calmly. Technique 4. 1-minute grounding/pause routine. What it is. When you feel distracted, impulsive, emotionally flooded, you pause for 1 minute. Take 3 slow, deep breaths. Notice your feet on the floor and identify one thing you can control in that moment. Why it works. The impulse system in ADHD can trigger fast. Introducing a pause helps recruit the longer-term control networks and break automatic drift. How to apply. Example. You're in a meeting, mind racing with tomorrow's checklist. You catch it. You pause, breathe 3 times. Name. My feet are on the ground. I will speak when the agenda moves to me. Then you return. Over time, this builds neural habits. Technique 5. Strengths mapping and self-compassion script. What it is. Recognize and write down your ADHD-related strengths, e.g., creativity, adaptability, hyperfocus when engaged, and pair them with a compassionate internal script when things go off track. Why it works. ADHD often comes with frustration about what I should do, rather than recognition of what I can do. Strengths mapping reframes your internal narrative. Self-compassion reduces shame and helps you reset rather than spiral. How to apply. At a quiet moment, write. When I feel distracted, I often am good at seeing patterns or generating new ideas quickly. Then create a short self-script. I'm working with a complex brain. I will pause, pick one task, and trust myself to begin. Use that when you feel criticism rising. These techniques are tools, not remedies. They build over time and work best as part of a broader support plan. 8. Do's and don'ts. Here's a quick list of helpful approaches, do's, and unhelpful ones, don'ts. Do set gentle structure and small manageable goals rather than everything perfect. Do build in movement, rest, and enjoyable tasks, not just discipline. Do speak with yourself kindly when things go off track. Understand that variation is part of the experience. Do use external scaffolding, timers, lists, external reminders, rather than relying solely on internal memory or willpower. Do connect with others, peers, mentor, coach, who understand this wiring and can help create accountability without judgment. Don'ts. Don't equate momentary failure with being lazy or incapable that fuels shame and avoidance. Don't assume perfection is possible. Focus on progress. Don't ignore your mental health needs just because you should handle it on your own. ADHD often benefits from multiple supports. Don't rely solely on gimmicks or quick fixes, e.g., just one focus pill or productivity hack without addressing lifestyle, mindset, and neural differences. Don't isolate yourself. The hidden nature of ADHD can increase invisibility and self-criticism. 9. When and how to seek professional help. You might wonder, when is it time to seek professional guidance? And what might that look like? When you might consider reaching out if you're consistently experiencing interference in major life areas, work, school, relationships, home function, due to attention, impulse, emotion, or executive function difficulties. If you feel stuck, you've tried lifestyle changes but still find that the pattern of distraction, impulsivity, or overwhelm is too heavy to manage alone. If you're experiencing other mental health concerns, such as persistent anxiety, depression, substance use, alongside attention, impulsivity concerns, since co-occurrence is common, if you're having risks, e.g., driving issues, frequent accidents, impulsive decisions hurting your safety or relationships, if you're uncertain about your experience and would value professional evaluation and personalized support. How this might look, a psychologist or psychiatrist can conduct a comprehensive assessment, explore history, childhood, adulthood, symptoms in various settings, executive function challenges, and rule out other factors, sleep disorders, mood disorders, learning problems. Therapy approaches. For many people with ADHD, evidence-based therapies include cognitive behavioral therapy, CBT, adapted for ADHD, helping with organization, planning, habits, coaching for executive function, mindfulness-based interventions, and sometimes family or occupational interventions. A professional will help you develop a tailored plan, combining lifestyle, behavioral strategies, and if appropriate, medication, more on that next, all aligned to your life context. Reach out proactively. Contacting a professional is not a sign of weakness. It's a sign of self-awareness and intentional care. 10. Understanding medication. Because many people with ADHD consider or use medication, it's helpful to understand how medication works, what it does and doesn't, and how it fits in the broader picture, always in neutral informational language. Medication for ADHD typically involves stimulants, such as methylphenidate or amphetamine derivatives, or non-stimulants, such as atomoxetine, under professional supervision. According to the NIMH, standard treatments include medication and/or psychosocial interventions. What it does, these medications act on neurotransmitter systems, dopamine, norepinephrine, that are involved in attention, impulses, and executive control. By modulating those systems, medication can help reduce core symptoms of inattentiveness, impulsivity, and hyperactivity in many individuals. They may help you use the other strategies, structure, time boxing, planning, more effectively because your internal regulation is better supported. What it doesn't do, medication is not a cure. It doesn't change your wiring overnight or remove the need for lifestyle, behavioral, or environmental supports. It may not be enough alone for all difficulties, such as sleep issues, emotional regulation, life skills, planning deficits. It requires monitoring. Different people respond in different ways. Adjustment of dosage and formulation is common. Side effects need discussion with your provider. Adjustment time frame and supervision. Often there is a period of trial and adjustment, finding the right type, dose, timing, balancing benefits, and any side effects. Ongoing follow-up is important. checking in on how you're doing, what else needs support, sleep, mood, nutrition. Open communication with your prescribing professional is key. Your goals, how you feel, what's changed. If you're or someone you care about is considering medication, please rely on an informed discussion with a qualified healthcare professional, aligning with your whole life plan. Think of medication like a tool, one among many, helpful when combined with lifestyle, skills, environment, and self-understanding. 11th empowering message. You are not defined by ADHD. Yes, your wiring and brain patterns may present challenges, but they also present gifts, energy, innovation, perseverance, unique perspectives. With understanding, compassion, tools, and support, your life can be meaningful, thriving, and engaging. 12. Quick recap. Let's pause and recap. Understanding. ADHD is a neurodevelopmental pattern involving attention, impulsivity, and activity level regulation. It is not laziness or lack of intelligence. Causes and roots. It involves genetics, brain development, neurotransmitter networks, and early life contexts. Symptoms and impact. Inattention, hyperactivity or impulsivity, time blindness. Executive function challenges affect daily life, work, relationships, self-image. Lifestyle supports. Good sleep, regular physical activity, balanced nutrition, structured environment, social support, and self-compassion all help. Actionable techniques, time boxing, if-then planning, journaling, grounding pauses, strengths mapping are tools you can start using today. Professional and medication support. If symptoms are interfering significantly, getting a proper assessment and exploring therapy and possible medication is wise. Medication is a tool, not a silver bullet. Support for loved ones. Empathy, scaffolding, strength focus, and partnership matter. Empowerment. Your brain wiring is different, not wrong. With insight and support, you can channel your unique energy into meaningful paths. Thank you for joining me on this exploration of ADHD. If you found this video helpful, please give it a like, subscribe to Mental Health, and share it with someone you care about. Our mission is to provide evidence-based, compassionate, non-judgmental information about brain, mind, and mental wellness. Crucial disclaimer. This video is intended for education and support. It is not a substitute for personal diagnosis or professional medical advice. If you're navigating significant struggles with attention, impulsivity, mood, or function, please consider reaching out to a trained mental health professional or physician who can work with you in your specific context.